So yes, welcome to our May edition of the ONE Online Improvement Committee. And you can see now that Angel has our icebreaker. If you put in the chat, if you were a big rich philanthropist, what would you invest in? And while you're thinking about that, I also want to welcome, we have a new member joining us, Susan Garcia. This is their first meeting with us. I said you people would all be very nice. I don't know if I actually said that.
Do we? Okay, we'll be nice today. Welcome, Susan.
And I'll add that Samantha was very excited to see you here as well, Susan.
Susan knows she's one of my favorite people in the whole world. Because when there's problems with the system, Susan tells me, she gives me great information about what was going wrong, including multiple screenshots and descriptions of all of her actions. And then when I'm like, hey, Susan, we think we can fix this. Can you go in and look? She goes in and looks and she tells me if she likes the outcome. So she is my favorite.
And I'm realizing we talked about this icebreaker idea like more than a month ago, and I never thought of something, so I have to think of something now. And if anyone wants to come off mute to talk about their idea, I see April has already put something in the chat.
Show off.
Well, I'll talk about what I would do. Housing insecurity, I feel, is a root of a lot of problems in our society. And I've been reading a lot about these tiny home villages that they're doing in Portland and how successful they've been. So I would take part of my money to support groups that have proven they can make tiny home villages work and work with housing insecure individuals to set up the rules in the community around that. So, really participant first focused groups. But also Girl Scouts is a special interest of mine. My kid is a Bronze Award Girl Scout and is going to be starting next month on their Silver Award. I would love to set up a foundation to help Girl Scouts do their silver and gold awards, especially for Girl Scouts who don't necessarily have the funds to fund it themselves, because I think the girls come up with such innovative and interesting ideas to make our communities better. Part of the gold and silver awards is that they have to be sustainable changes. So they can't just go do a park cleanup and call that good. They have to make a change in the world that will continue on. I would love to make a fund to give the girls all the funding they need to make those changes in the world.
Cool. I think I would do paralyzed vets. Our paralyzed veterans are really struggling, and they don't just need funding for equipment and things of that sort, but they need funding to have people come in and help them, and caretakers, etc., and so on, because they're kind of like on the federal cusp of always being cut off on programs. And I feel like our veterans have been left out. So that would be my place. I would do that.
Mine's similar. I have a lot of things I would like to support, like housing insecurity and addiction services, but the closest to me is mental health services for veterans.
Mm-hmm. Yeah.
My dad's a veteran, and he is benefited immensely from the support that he has got, but he's in a position where he's been kind of, privileged to receive the support that he has got. So I would like to see that expanded to different communities as well.
Oh, and I should have said earlier too, this is Andrew's first meeting with us.
Oh, welcome, Andrew.
Hi, everybody.
Want to say a little bit about your role, Andrew?
Yeah. So I'm working now with the ONE BA team, a business analyst specifically for applicant portal and the applicant portal mobile application. So yeah, working closely with Sam, trying to learn as much as I can.
I'm sorry, African mobile?
Applicant portal.
Applicant portal.
Yeah,
Okay,
yeah,
thank you.
And the applicant portal mobile. I kind of
Okay.
mumble sometimes, sorry.
Thank you.
Every day I drive by this billboard for the lottery, and Sydney knows. Sydney's actually right here behind me. And so every day I drive by this billboard that has the lottery numbers, and so that's why my answer is so fast, because I think about this all the time. Like, what would happen if I won the lottery and I would give money to Street Dog Hero, which is a dog rescue here in Central Oregon, where we got our dog Bacon. And they rescue dogs primarily from Mexico and other countries, but also they take in a lot of dogs from overfilled shelters that are at risk of being euthanized, and they put them in foster homes and all that stuff. So I would give them a bunch of money. And then, as some of you may or may not know, Sydney and I work within the confines and the prison, if you will, that is ERDC, and Vanessa, when it comes to serving families and helping them access childcare. Right now, there's a wait list with really no end in sight. But also what ERDC pays providers doesn't always cover the cost of care for families. Excuse me. So I would want to have a fund that families who are making higher income than what ERDC allows for, which is 200%. So $5,000 a month before taxes if you're a family of 4. So I would want to have a fund to cover that after pay, or for the people who are like the Alice population who are outside of those really low income thresholds, who need help paying for childcare.
I think Dion, that's incredible. Looking at hydroponic technology to help hunger. I think that's awesome. Awesome. Hunger is definitely a huge thing in this country. And when you think of our children not having enough to eat, that just breaks my heart. Of course, it breaks my heart every time I see the dog commercials, when their poor little things are being starved to death. I'm a real softie. I may not look like it, but I am.
Well, I want to mention that, Vixen, that background you have, the Aurora Borealis, makes me want to ask, did you see that?
No, darn.
I didn't see that one, but the one that we had here was pretty spectacular because we don't have any city lights. So we were out at our cabin, and
Well,
it was pretty cool, especially when you look straight up. It was phenomenal. I can't even explain. We were out, we call it the Indian ground. It's what the Nez Perce tribe owns. And we were out on the edge of the Joseph Canyon. So
oh, did you take any pictures?
I did.
Oh, cool.
So it was pretty. My dad didn't believe me. He's like 70 something, and we begged him to go with us. And he was like, I don't know what you're talking about. Northern lights, like that's Lewiston, Idaho. And I was like, no, Dad, there will be northern lights. And then when we showed him pictures, he was like, you guys weren't crazy.
We older people, we just don't give up with those older ideas.
Yeah, he doesn't watch social media. He doesn't watch the news. So he knew nothing. He totally thought we had lost our marbles.
I love it.
All right, well, why don't we go then to our next thing on the agenda. And here are a little recap of what's in the pipeline, just to let you know. I think we had something like this last time. It's a little more spelled out. Well, actually, I don't even remember, but if you all recall the red X and the pencil, and we got talking about how much these icons that show up on screens, they should be explained.
Mhm.
And so it turned into a 6-part build because it's in a whole bunch of different places. And so it's slowly making its way to the system. Samantha, anything to add on that request for?
Nope, it's just slowly making its way through.
Oh, all right. Then we have some small font, but some of our other work, let's see. Adding the, oh yeah, adding a message to the dashboard for non-head of households to make sure they check the right place if they receive the notice for
Mhm.
message. And we will soon get that ERDC client well, shortcut to let people know that they're still connected with their provider. And then the survey is coming right along too. So any questions about these or any of things to add?
Looks good.
Well, this is going nice and fast. So this is where I throw this to Samantha. Oh, we didn't send out, we made so many changes, I didn't bother to send out the description of this request here, but so we're gonna have to verbally talk about it.
I remember all about this request. So remember how we just did that big update to the miscellaneous docs upload screen? Got it all done, got them submitted, all those changes are in, and then somebody said, hey, we should also add prompting college students to upload their financial aid docs onto that list, which is in fact a very good idea. Whoops on us. So we're being asked to reopen it again and add one more line. I believe when we were looking at it, though, we did find a couple of other places where we decided, you know what, we thought we worded this the way we wanted to, and we want to tweak it just a little bit more. So I know we do need to bring that back to look at the text again, figure out how we're going to slot in prompting college students to upload their financial aid docs and make any text changes we want to do.
Hopefully that rings a bell. We can bring it up on screen if you need any reminders. But so Samantha, we still need to get a example wording out to everyone. Is that where we're at?
Great question. I think we had decided to take it up and we had started working on rewording it. And we ran out of time is basically what happened.
Yeah, and then we didn't bring back the wording for this group. That's oops, that's bad on us.
James just dropped a screenshot into our chat, so if we do want to look at it and pull it up on the screen, it's there.
Yeah.
We want to.
Yeah, that's okay.
I think the screenshot only went to you because I don't see it in our chat.
Yeah, we can't drop in the Zoom chat. Here, Angel, I'm gonna go ahead and I've got it up, so. Try to make this bigger.
So yeah, with this one, like I said, we had just discussed
Yeah.
a fifth bullet point.
Right.
Okay. Well, do you want to talk about the wording right now? Would that be helpful?
If that's how we want to use our time, I think that would be a great thing to do. We could just kind of knock this one out and get it sent over for work item. I'm seeing Vixen nod her head. And double thumbs up. Ooh, let's do it.
All right. Well, then. Let's, oh, go ahead, Sam.
No problem. Can everybody see the text on screen so far? Pretty well? Yeah. Okay. So I think, no, what I had done is I started to write some text and then it cut off, I remember. What I suggested is we start this one with, for students of higher education, so that we ensure we're calling out the right people. But then I wasn't really sure what else, how we would want to say this in such a way that students of higher education would know what we're looking for.
Yeah, when I seen that, I was like, okay, what exactly are we wanting them to upload? When you say financial aid documents, are you thinking like their FAFSA
financial aid
forms?
award letter? No, it
Yeah.
would be the financial aid award letter, because the FAFSA forms don't always mean that you are eligible. So I think it would be like the financial aid award, whether it's like a Pell Grant or whatever you qualify for.
And then what about scholarship forms? Or would we want something from the colleges themselves?
Well, and do they only need scholarship forms if the scholarship is going into their bank account, as opposed to if it's like sent directly to the school? It doesn't really matter. It shouldn't really matter, right? Like, I have a scholarship that's paying for my master's degree. Nothing hits my bank account. They just send it to the school.
So, April, does your scholarship show up on your financial aid award letter, or do you have separate documents for it?
So I actually got no financial aid from like when I filled out my FAFSA, they were just like, here's some loans you can take out. I'm like,
Yeah.
thanks, but no thanks. So the scholarship doesn't show up on that at all. It's like the school is here, right? And FAFSA is here, and the scholarship's coming from up here. So it doesn't even show up on there. But I did get like all my taxes this last year. I didn't get like anything saying like, oh, you got this scholarship. I just got the stuff from the school, and then saying how much we like paid for tuition and who paid.
I think it's like called like a 1089. If you're receiving actual money, like, because I think with April, like that's not income, it's not countable income. Financial aid, they do count. I want to say it's called like a 1089, and that's the tax form that you get when you've received payments. And usually your financial aid award letter will tell you, because like same thing, like my husband applied for financial aid. He was given a very small grant, which went into our bank account. And then the military is tuition assistance, which is reimbursement, but that doesn't count because we're paying it and then they're paying them back, but we're not receiving the money. It's going all to the school. So when we did our taxes, the only thing that was countable was what was received through financial aid on that FAFSA award letter, and you get a 1089. I want to say it is.
Yeah, so maybe it should clarify, like if this money went into your bank account. Then
Why couldn't you say, I mean, like Vanessa says, it's a 1089. So perhaps we should say, on the 1098, I'm sorry, 1089, because that way they would know what piece of paper to look for.
But if they haven't yet gotten the paper,
Yeah.
they're not getting that to your tax season. I don't know. I just try to think about like when I was 18 and I didn't know anything about anything, even like financial aid. So if they need information about that, I just think it should be in really clear, plain English.
Absolutely.
And Spanish and Russian and all of the languages.
Yeah. Oh, it's a 1098. Okay.
So I'm trying to reach back into the deep, dark annals of when I did policy or when I did eligibility over a decade ago. And I believe we need, even in April's situation, the scholarship that doesn't hit her bank account, because what we'll do is we'll take the income of the scholarship and deduct the cost of the tuition. If April, you weren't to report that you're receiving the scholarship, but you report costs of the tuition, a worker who received that would probably be like, huh, what's going on here? So you may end up needing to provide it anyway.
Yeah, I'd agree with that, Sam. I think, again, it's also been a while since I've been directly in policy, but depending on the program, we would want to see what's being used to pay the educational income, and if there is any left over, how else we might be able to exclude that, whether it's like room and board, meal plans, things like that.
Books, fees, etc. Yeah. So I think we need to spell this out. So it's your financial aid award letter or award letters from any scholarships. I don't know. It's been so long since I've been in school too. I don't know what else people could get. Scholarships, awards, etc.
I just put some text idea for people to react to in the draft. Don't think it's anything official. Just
so if it's something that member need to provide, wouldn't they get a notice from OHP asking for more information or asking to provide, proof of this? Would make it, kind of hard. Just, yeah, not sure.
So yeah, definitely if we're pending and asking for that information on the agency's side, they will get notice of that. But I think what we're working on is from the website where someone would apply for benefits as they're entering their information about income, education, things like that. This is a chance for them to kind of preemptively upload that information so that maybe we have that available to us and we can use that before we have to send out those pen notices.
Okay. Okay. Thank you. But I think usually those notices will come out no matter we already uploaded here or not, but maybe I'm wrong. But thank you.
They would come out if they're applying for Magi Medical, but if they apply for any other program, they wouldn't come out immediately. So if they apply for SNAP or childcare, cash assistance, and some of the non-Magi programs also do not pend for everything up front. So just trying to get people to understand they can provide things in advance. You are right, though, that actually if somebody is applying for medical and they go down the Magi route, and that's all they apply for, they actually don't even see this screen, because Magi does produce that screen that I'm sure you've seen a bajillion times, that tells them exactly what they're pended for. So this screen isn't necessarily a problem for Magi medical only participants.
Yeah, so
Okay, thank you.
I just ran into the rabbit hole because I pulled up my husband's because he did this like 2 semesters ago. I can somewhat share. It's confusing because I see the email of what he was eligible for, but then I looked at what the school said that they were going to accept and what they took, and that does not match what FAFSA said, a certain amount, but when we did our taxes, it was a smaller amount than what was actually used. So I think we need to verify what they're actually looking for, because even if I was in this position, I'm like, do I send this? Do I send that?
this is sounding like a bigger task than adding a bullet point.
Yeah, it sounds like we do need to confirm exactly what policy, which documents policy would want to receive to be able to determine eligibility. So let's take this back, and we'll do a little more research and bring it back with the the list from policy of what they would need for us to start drafting some text on it.
Okay, that makes sense. Any other comments or questions people have on this? Or things that we should be asking about? Okay. I'm still speaking, putting pauses in case an idea pops up.
So are we going to put this aside until we get more information and then move into another section?
Yeah, that's the idea. All right, so here, I'm going to stop sharing, Angel. Let's get back in our agenda, although, well, anyway, yeah, that back up, and in theory, we're going to take a break, but we're ahead of schedule, actually, because anyway. So let's skip the break for now, because we're still early in the meeting, and let's get to the big kahuna of the report a change screen. Now, you did, this morning, again, our apologies for getting the agenda and materials to you so late, but you did get a spreadsheet this morning that sort of lays out all the options in a new way of the report a change screen. Now, Angel, do you have that ready? Or I can share it, either way.
I can share it. Let me just grab it one moment.
We get to see all your emails and such. But I encourage you to open it up while Angel's bringing that up so you can see. Now, you probably remember the screen itself. It's just report a change. And I always have to remind myself that it's going to vary according to whatever programs you're in. And that's what the separate tabs are below. But the all program is the one that has the nice tools for us to manipulate and check. So this is, and I warned Samantha about this. This is the part where it's like, oh, Samantha, you're going to do a lot of talking on this part. So you have it, Angel?
Yes. Let me know if you can see it.
Cool.
I can see it.
Okay.
All right, guys. So just to level set everybody and our new folks on what we've been working on, we decided to take on that giant report a change screen that was just like 20, almost 30 options of checkboxes of what you could choose to report a change on. I will tell you guys who haven't heard it before, and those who have heard it before will hear it again, that even when I'm in the system testing, when I was trying to navigate through that giant list, I could never find what I wanted to find. I would just Control F and search for the word. And that's a real sad situation. That means that it is not a good design for our community partners and for our users. So we kind of looked at different ways that we could make that screen a little bit easier to deal with. And one of the suggestions we came up with was kind of grouping it by where it navigates to. I misspelled navigate. I'm looking at this tab and I'm realizing I misspelled navigate. That's embarrassing. Please ignore that. And I'm sure if I hadn't called out, nobody would have noticed, but here we are. So we decided we were going to group them together by where they navigate to. So we didn't have, 6 options that all ultimately navigated to the same space. We decided we wanted to rewrite the header in such a way that it did the lead in of there's a change in, so that it was really simplified so that people didn't have to read there's a change in A, there's a change in B, there's a change in C over and over and over again, scrolling as they look through this list. They could just use their eyes, quickly glance over it to find the things that they do need to report. And then we talked about how we wanted to list them, what order we wanted to list them in. So some of the suggestions we had were in alphabetical order, in order of what order they come in when you're applying, and what's the most common, our most frequent changes to be reported. So if you look in column A, I've done my very best to reword these. If people say, oh, that still doesn't make sense, or hey, why don't you change it in this way? I'd like to love to look through those. I'm not feeling super duper confident about row 8, situation for the member of my household, because it's kind of vague, but also everything under that is kind of a grab bag. And then also there was row, if we could scroll down a little bit more, there's one I highlighted in yellow, because I definitely don't think I worded that very well. Disability information. Also pretty concerned that I didn't do a super great job on that one. And I would love for us to look through the text holistically and discuss, but put special care on those two. And then once we're pretty sure we have the wording we want, we can go in and decide which order they should appear in.
Samantha, I have a question.
Tell me.
On the form that we received in our email, the gray areas were blue. Is that the way the consumer is going to see it, is with the blue areas?
I actually didn't look at what got emailed out. Let me go look at that.
Well, your gray areas, are they going to be, are they highlighted in some way, since you have gray, white, you know, and obviously the gray areas are areas that you define as something you want to look at. So I was just wondering if they were going to stay gray or if they're going to stay blue. I know it's a weird thing to ask, but
no, that's totally reasonable. I believe they're going to stay gray.
okay.
I'm trying to remember what the screen looks like off the top of my head, but I've been looking at the spreadsheet for so long that now I don't remember really what the screen looks like. So it does stagger white, gray, white, gray, white, gray, and it has borders between each line. So
okay.
Yeah, to really call out that they are different.
It makes it easier for the person who is reading it to have little breaks between, which is good. Is, you know, that makes it easier to read than just one big white page of little tiny print. Okay, so are we looking at the disability information? Is that the number 14? Is that what we're working on now? Or do you want to go back to 8?
Honestly, I'd like to start at the top and just make sure that people like what they've seen so far. I did a pretty substantial rewrite on the lead in text. So that's a text that's at the very top of the page. It normally has the page title. The title of this page is types of change you are reporting. And then we have a little like instructional text. It says, please check the boxes that describe changes for your household. If you need to report something not listed here, please contact us for help. And that if they click that contact us hyperlink, that where it's underlined, it will be a hyperlink that will open up a page with contact information of how they can, contact the VAC or get contact information for their local office. And then next it says there is a change in, and then it gets down to our list. So first one being physical address, mailing address, or contact information. And if you guys just speak up and yell if you think something's confusing, you don't like it, or you have a different suggestion. Next one is members of my household. This includes a new household member due to birth, adoption, marriage, or someone moving in, someone leaving the household due to moving out, divorce, death, or another reason. Next, we have income. This includes a new job or source of income. A job or source of income has ended. a change in work hours or the amount we get from a job or income source. Someone is away from work to care for a sick child. Expenses. This includes the amount paid, who pays the cost. Relationships in my household. This includes marriage, divorce. Okay, now we're on to number 8, and this is the one where I was like, man, I really don't know what to say for this one, so I'm just gonna put something and you guys will tell me if you hate it. Situations for the members of my household. This includes pregnancy, start or end, Medicare, start, end, or change. Somebody was involved in an accident or was injured.
I don't mind the way that says. Is that also where we would put in incarceration?
Incarceration is going to be on the next one.
Okay.
Yeah.
Okay, well, what is the definition of somebody was involved in an accident or was injured? Okay, you know, my daughter was hit by a car, or I fell off a ladder. What is this? Somebody was involved in an accident or
it is
injured.
exactly what I said.
So it's up to somebody else to figure out what the injury and accident was.
So it'll collect some information. What it is used for at a policy level, if I can maybe explain it that way, and you guys can help me sort through this. For medical and for cash assistance, it's not necessarily just that, Dion. So for medical and for cash assistance, they're looking for scenarios where there may be, for medical, they're specifically looking for scenarios where someone may have been in an accident or may have been injured, and medical claims should have gone through a PIP claim rather than being paid by OHP. So OHP would want to recoup that money. For cash assistance, they're looking for basically, are you going to get a lawsuit payout?
Good definition.
Pardon?
Thank you. That was a very good definition. Thank you.
So I don't know if that's the best way to say it. You don't necessarily need to be so injured that you can't work. They're just looking for, like I said, for those 2 programs, the ability to recoup money into the program based on you getting some sort of payout or somebody else being liable for payments to you or payments to a provider.
That could be a very long time.
It could, yeah.
So does this person lose their insurance while they're waiting for a payout?
Nope. What happens, so for medical, what happens is they will keep their OHP. It's no problem. OHP has individuals who pursue, I like injury settlement, who follow up with the car insurance and pursue reimbursement. So it doesn't impact the individual who is receiving benefits at all in that case.
Excellent. Excellent. Thank you.
I kind of like changing it to say somebody who was involved in an accident, or we'd have to massage it a little bit, but saying injury settlement rather than or was injured might be more correct. I like that, Dion. Oh, that's a great clarification. Susan put in chat, the application says that they only need to know about accidents or injuries they could get a settlement for.
Isn't it also if the other, like if it's somebody else's property or something, or somebody else can pay for that other than just a settlement?
Yeah, I know they will pursue, I know that they will pursue other insurance claims. So like if I was in a car accident and I should have had my I should have had the hospital visit billed to the insurance company as part of a PIP claim, but I had them bill OHP instead. I know OHP will pursue getting reimbursed for that. Yeah.
Mhm.
So maybe we can reword it, and let me get my spreadsheet up so I can take notes as well. Or I'm going to be immediately sad because I won't remember. You can say something like, we'll remove somebody was at per NJ's comment, and then we'll say set.
Why not start the sentence with involved in accident or was injured pending settlement?
You gotta say that again so much slower because I'm a slow
Okay,
type.
all right. Start the sentence with involved in a accident or was injured pending settlement.
Okay, I think I got it.
Okay, everybody, jump on. Let's rip it apart. Let's go for it. Let's see.
My question is this how it's listed, just like one after the other with like no rhyme or reason? Because it's just like so many things, and some of it seems like duplication. Like it looks like members of my household knew due to birth, adoption, marriage, but then it's down here again, pregnancy, start or end. Like, is there not? It just seems like such a cluster. And me looking at this, like I can only imagine it on the sheet. I'd be like, I'm done.
Yeah.
There's no change. We're good.
Yeah. Mm-hmm.
So yeah, it definitely is a bit of a cluster, but I think the two, at least that you mentioned, they lead to separate screens. And I think part of what Sam had been working on was the best order for this. And I think one of the options is the order in which the screens would queue in the system, which I think is more of a benefit to people who understand the system rather than someone applying for benefits. So I think that's part of what we're trying to figure out as well.
So what do you mean it'll be a difference? It will lead you to a different screen if I'm pregnant versus I've just had a child. That's a different screen.
So yeah, one is like if you're adding somebody to your household, whether that means like someone you just had a new child and you're adding a new child to your case, but also reporting a pregnancy or the end of a pregnancy in our system is a separate screen because that affects eligibility for certain programs differently than adding a new person to your case would.
So instead of adding a separate question, wasn't it like a drop down, like start or end of pregnancy, and then it's like started, like, but there's, and then versus end, like, is this, then yes, increasing household size, like versus doing it two different places? Because I don't know, it just seems like, yeah.
No, that's a totally reasonable bit of feedback. And it's something we've been struggling with for the past 4 years. The system is architected to collect individuals and then collect pregnancy start or end. And ending a pregnancy doesn't add an individual, nor does adding a newborn end a pregnancy. So this is something that we actually have to pull reports on monthly. And it's a bigger architectural change. You're calling out something that sucks, and we're aware. A little bit bigger than the scope of this, but not a bad thing to call out because it definitely does need to change. It's a big one though.
So the answer is no, they cannot be combined. Like same thing with like marriage, like members of the household versus situation. Like that's like, it's again repeated. So
they go literally to different screens and that data is collected on different screens.
So I think part of the question is, right now the list is done by what changes are the most common to make, and maybe we should be grouping them by subject area to help draw that distinction out as an idea.
Angel, if you flip the sort to flow, people might like that a little bit better. So up on column E, click that one and do smallest to largest. It already has the filter.
The little arrow, yeah.
So this is the order that the questions are asked in the system. But as you can see, relationship is still kind of down there. It's a little bit out of the way from the other questions.
So
So
this is arranged by the landing page, right?
right
Okay,
now it's
thank you.
arranged by the order the landing page is in.
Okay, thanks.
Yeah, that seems like relationships in my household, but then a tax filing status would only change due to a marriage or divorce, right? Like, that's where it's like
Not necessarily.
moving out of a house and being,
Yeah, there's scenarios where it could change. Like without doing anything different in my household, I could choose to file married filing separately next year rather than married filing jointly, right? But we could try another grouping that's like
James's idea that he mentioned of trying to group them by like related, by how they're related, or more similarly, would make it more readable for someone not familiar with the system or policy. So like having anything related to a household change, like new members, relationship, pregnancy, things like that in one area, and then like income and tax filing status and things like that in a different area would maybe make it more readable.
we could look at something like that. Okay. Angel, can you go ahead over into row 1 of column F and write category in 1F? Nope, up one more. There you go. Type category there. Okay, in 2F, put 1. Okay, and then let's go through and find all of the things about members of the household. So row 4 should have a 2. Row 7 should have a 2. Row 8 should have a 2.
You want me to
9,
put 2 here? Sorry. Is that what you're meaning?
column F.
Oh, okay. Oops. Row 7, you said?
Yeah, so far I'm seeing 4, 7, 8, 9. And then a bunch that I'm not sure how people will want to put. Up on 3, let's do 3. Make 5, 4, 6, 5. This is fun. This is like the worst game of bingo ever. And then go up there and sort it smallest to largest, and that'll give us an idea of what it's looking like. And let's see if that vibes better with people, and we can, massage the text from there. So, what we're talking about is types of changes you're reporting. There's a change in can you take the 2 off of healthcare needs? That's currently number 4. And then take it off of tax filing. Make The current number 7 to make the current number 8-3. Okay, and then go sort it again. So this is starting to clump things together. We could say there's a change in my household, relationships, members, that sort of stuff. We can kind of clump it together this way. I'm not sure if these sortings are making more sense for people.
I think this makes way more sense to me just because it's subsection, because if it has nothing to do with my household marriage and it's my income or my need to change healthcare, like I can scroll down versus having to read each individual one and be like, oh, there it is. And like you said, it'll be easier to find if it's in subsections.
Okay. So
How does everyone else feel about it?
I
Does
think I
anyone-
agree. Yeah.
okay. So we'll do
I was just gonna say it's tricky because, you know, things will be related in different ways. We're stuck on just one line to put things. And so there's always going to be things that are going to be a little odd out, but I hesitate to say you can put I sort of like, obviously I like the categorization too, but it's there's always going to be odd ones that don't quite fit, you know, can fit in multiple categories.
mhm.
Hey, and we're actually due for a break.
Okay.
So
Yeah, let's take a break. I'll try to futz around with this really quick and see if I can get something together for people to react.
and Angel, can you just leave it up? So leave up the spreadsheet so people, if they're following at home, they can match up what we've got. But otherwise, we'll see you at what, 11:09, I guess. welcome back from your break, and we'll continue talking about the categories.
Okay, I've got a thing. Angel, can I share? Let's find out if I can share. Let me see if I can do this. I'm very bad at Zoom, you guys. We're all about to learn how bad Sam is at Zoom. Okay, share screen 2. Share. Hey, there we go. Okay, so let me make this smaller.
You want my name for the record?
Well, I guess I should let everyone know our co-chair George is back from his other important meetings of being a popular guy. But George,
If you
you
were
want to say
first,
anything?
I wouldn't want it. That's all I'm saying. Stop being a good resource, George, and you won't be so popular.
Ha ha ha.
All right, so I'm not seeing people jump back on camera yet. So I hope people are here. I see Dion, I see Ann. Oh,
We'd
there's
love to see
Susan.
you. Yeah.
Hey, I say it and then people are like, oh yeah, my camera. So cool. Thank you.
I'm here. I'm just being quiet.
Well, why? We don't like that. We like you not quiet. Oh, and Maria's here under the weather. I'm sorry to hear you're under the weather, Maria. Okay, so kind of went in. I created a new tab. I only have a bajillion tabs, guys. This is actually a pretty low number of tabs for my work, for my working files. So what I did was I sorted by category. And I kind of tried to like guess on how we would want to sort things. And you guys can tell me, no, Sam, this needs to move. That's fine with me. So I thought maybe our categories look something like my household. So these are changes to the whole household.
Hey, can you make it a little bigger, by the way?
Yeah, I can try. Yeah.
That's
Is that
good.
good?
Yeah.
Okay. So my household, these are like kind of bigger changes to the entire household, right? So members, relationship, situation, living arrangement. This is the one where we slotted in entering or releasing from jail or prison. I also remember we had talked specifically about entering or leaving nursing homes, rehabilitation facilities, or assisted living facilities. I recall somebody mentioned this was a problem of people not knowing where to report when they leave these facilities and it messing them up. So I did that. And then contact information, because these are kind of like whole household changes. And then please, you guys know to just talk over me if you need to, or if something shows up in chat, because I can't see chat right now. And the next individual details, and we can rename this. I just kind of jotted something down really quick. And these are like for one person or for two people, maybe, like, but not a whole household change. This is like a person change, person's situation change. Immigration status, school attendance, healthcare coverage, healthcare needs. This has a little placeholder. Don't worry about that placeholder for right now. That'll go in December. I just had to put something for policy to make them happy. It will not show up until December. We'll add that text in December. Disability and military or veteran status. And then the last grouping is financial information. That's income, tax, filing status, expenses, resources. And then for some programs, they'll have a space like something that's listed, something that's not listed in the reasons shown above. It'll open up a free text, but that's only for SNAP and ERDC. So it's all the way at the bottom. So is this kind of looking a little bit more like what you guys were hoping to see?
Yeah, that's so much easier. And I think just to navigate that page alone. Yeah.
Awesome. And then do you like these titles, or should we change the titles up? I'm zooming out a little bit just so I can get all three titles, and I'll adjust. It's not going to let me do it. It's going to be just a little bit too much. So it's my household, individual details, and financial information.
You know, Sam, you can get rid of the ribbon at the top too. If you yep, there you go.
Hey, and then I'm gonna forget that. I'm gonna be so mad later.
So
right.
Sam, this is George. Is this going to be in a form where people will fill out for services?
So this will be for people who currently have benefits and need to report a change to them.
Okay, so what's the numbers on the side for?
Those were helping me to sort it. You can like literally ignore these, pretend they don't exist. That just helped me set it all in order.
Okay.
Not having to copy paste a bunch. So ignore it here. Let me hide them so they're not. There. Don't worry about them.
I think it's perfect to have the categories. I was just going to suggest that before our break, because there's nothing to draw the eye to anything on the list. I usually just say there's something else I need to report and go to the next page where I can actually go to the place that I know where the thing is. So like having my household, individual details, financial, so you know actually where to go on the whole list is really helpful.
Awesome. I'm like struggling with individual details because I don't know if that's really good wording.
Yeah. What are our titles again? We've got household.
My household, financial information. I think financial information is correct. I feel like my household is correct. Individual details is like, that's what I name a screen. That's not like a category for people. It feels like I don't love it.
What about stat or like individual circumstance or?
It almost feels like there's two categories there. There's health.
Yeah, it feels like there's healthcare and then there's like, because I feel like immigration, school, and veteran are one. And then healthcare coverage, healthcare needs, and disability are another.
Healthcare coverage, healthcare needs, and disability are another. Okay, so let me reset some of my numbers. All right, hopefully that just sorted that in a nice way. Insert. Put a little, well, now we have to figure out another title. So I think that was the right choice, but we've made more work for ourselves. But also you guys got to see why I have all these weird numbers around here, George.
Okay.
What is the question? It says reporting a change
Reporting
about
a change.
individual circumstances or an individual. But also understand the individual circumstances too. So
and person. Samantha. A person in my household, maybe? So we've created this new section that has healthcare coverage, healthcare needs, and disability. What would we like the header to be on that?
What about health or healthcare status? Health/healthcare status.
I'll go with that.
Samantha, are we able to maybe include that in the individual part?
We just had it in individual and then we split it back and then we split it out. We can put it back.
Okay.
Here, I can, like, we can see the two ways it can be, right? So here it is hidden where it's one thing and they've been sorted so that the 3 non-health related come first and then the 3 health related come after. Or we can give it its own kind of header.
Samantha, yes, this is George. With it comes to permanent disability and determining the blind and stuff. Normally as a rule, when I go into forms, it will have like veterans either with it or underneath of it for veterans. Because sometimes when veterans are veterans, they also can be considered as disabled.
I agree with you, George, but the Department of Human Services doesn't take a VA determination of disability as permanently disabled.
Okay.
And then sometimes you just have younger folks that only did 4 years and they're just changing from active duty to civilian.
So we could put them together, but they won't necessarily. The disability screen is where you will document being disabled. And I do not believe that it asks you how you were determined disabled. It's very high level, like, are you permanently disabled? Are you blind? Are you both? Whereas the veterans or military status one collects those questions. It actually is a workhorse. It started originally just collecting data because we're required to provide information to the Oregon Department of Veterans Affairs for any veterans or active duty military members who apply for benefits with us so that they can reach out and give additional resources. But now it also collects information. There is a child care program that stabilizes child care when a member of the household, and Vanessa, you're gonna have to correct me. It's either when they start active duty or they return from active duty. I cannot remember which.
There's multiple programs. There's some that there's a lot of programs, and it also depends on the branch.
Oh, so fun. Policy is complex. But then the third thing that screen collects is actually it assists in collecting data for individuals who may not be eligible for OHP but are veterans and may be eligible for the Veterans Dental Program. So it's kind of a workhorse. So I could see it either being an individual or being in health and healthcare. Well, maybe with
I
the
think
header.
it should be its own. I think it should stay as it is, because like you said, that's like, there's so much that goes into it. I think as it is, as a person in a household, I think it should stay where it's at. I don't think moving it under disability or healthcare really wouldn't make sense, because you're only thinking of one small subgroup.
Okay. I can see that the chat number is going up and I cannot see what's being said. Is there anything, James, that I need to know? Any suggestions? Okay. Okay. Did we have any other outstanding questions? Oh, did we decide if we liked this text on disability information, or do we want to massage this text?
Well, for me, I will go with the group and what they decide on that.
Samantha, I have a quick question about the disability part. Maybe someone had already asked it, but was there proof of documents needed for this?
Actually, it's funny, George did ask that. And no, you're fine. And the answer was sometimes. So if somebody has already been determined disabled or blind by the Social Security Administration, we can actually see that when we're going in to do all of their verifications and everything. Social Security does provide that information. Oh, yes, they're disabled, or oh, yes, they're blind, for us. There are situations where somebody is permanently disabled or is blind, you know, that something has happened in their life, situations have changed, but they have not yet gotten that Social Security determination. And they may potentially be eligible for programs where the state will say, yes, we're pretty sure Social Security is going to find you legally blind or permanently disabled. So we're going to preemptively give you that designation. So in the first case, if Social Security has determined it, we don't need any further. We can verify that all through our connections with SSA. We have interfaces that give us information from SSA. For those situations where they haven't been yet, but they could be, they will need to provide paperwork, etc., but not at the time when they apply. And they will have a worker, a specialized worker, who will walk them through that entire process, because it can be complex. They get like basically a special caseworker from that team who helps them get to that determination of, yeah, we're pretty sure you're going to be found disabled by permanently disabled or legally blind by SSA. So we're gonna preemptively say yes. So there can be more paperwork, but
okay, so it's not like determined by the healthcare provider, but by Social Security.
Yeah, it's those, it's permanently disabled per Social Security definitions, basically.
Okay.
Do we need to add something about requesting long-term care or developmental disability? Because I know it's all lumped into the same disability questions.
So the long-term care is actually up here in row 15. It's needing help with activities of daily living, like bathing, dressing, etc. That's actually the question that would trigger that determination. Also living in a medical facility or nursing home and needing help to pay for these support services. These are the questions that will trigger that evaluation. It's actually not, shockingly enough, it's not off of the disability screen. There's a specific question that says like, hey, do you need help with activities of daily living? And do you want us to contact you for assistance with paying for those?
Should we add the developmental disability to that then?
I don't think we actually screen for DD services out of ONE.
It's in the same question as long-term. Do you need help with daily activities due to, like bathing, dressing? And then it says, or do you have a developmental disability? The same question for long-term care prompts DD services as well.
Oh, it does trigger over to DD service. See, this is why I love much, Susan. Some people need help with activities of daily living or live in a medical facility or nursing home. These people might qualify to get help paying for these support services. This can include adults and children that need care for intellectual or developmental disabilities. Okay, great. How do we want to add that in here? I need to expand this a little bit, so.
Well, the thing is there's more than one or two types of disabilities. There's the hard hearing, there's the blind, there's the physical, there's the mental, there's all kinds.
Well, how was it previously phrased before, to see how we can kind of pull from that?
How was it before? Awful.
It could be put on there like, or any other type of disability that would clarify any type.
So what it said before was someone in my household needs help with activities of daily living or lives in a medical facility or nursing home and needs help to pay for these support services. So what we can do is modify this because what do we think of that? Needing help with activities of daily living like bathing, dressing, etc., due to physical, intellectual, or developmental disabilities.
I like that.
Susan, is that gonna be what you would be looking for? Is that gonna get you there?
Yeah. Just because it's so hidden in that one question that parents usually go over it when they're doing applications for their kids.
Yeah, I mean, I literally forgot and I wrote the question. So what you are saying is 100% correct and valid. It does get missed.
Do you think there's a better way to phrase it where parents might not skip over it?
This question, this one we've been over a bajillion times. There's probably a better way to write it. And that's definitely something I would love to take up, but it is a very particular one because we need to ensure however we rewrite it, that is a single yes, no. And it does not confuse people such that they say yes for like a 2-year-old who doesn't have intellectual or developmental disabilities, which was something we struggled with in the older version of ONE, Magi ONE, where we would have lots of people saying yes to this for their toddler.
So that, I mean, my question was going to be, can we include, this includes children or adults and children in the other one, or if that's going to run into the same?
We can,
like adult or child needing help with activities. Okay.
oh, you're saying, do it over here? Like that?
Does anyone else have suggestions?
Well, this would clarify it. I mean, because now we're getting into cerebral palsy and ADDA. I think that would clarify that.
So this is asking, so for the member who wants to apply for Medicaid long-term care service, will be clicking this, right? But it sounds like that you need to have a disability to be able to pick this option. But they don't necessarily have a disability. They just want to apply Medicaid long-term care services because they need help with activities of daily living.
I'm not sure. I'm not sure I understood exactly, NJ. If you were making a suggestion or if you were happy with the question.
Oh, I'm sorry. I was saying how it worded sound like you choose this option if you have disabilities. But usually the members I serve, they will need to choose this option if they want to apply for Medicaid long-term care services, but they don't necessarily have disability. They just have a they just need help with activities of daily living.
Oh, aged individual, or yeah, aging individuals.
Mm-hmm.
I see what you're saying. Hmm.
Maybe we need to like word it including
I think,
physical. Mhm.
what have I done? I think I might want to break this into two, right? Because we're getting into a lot here. Maybe adults,
Right. Okay. Yeah, that might be better.
or it's gonna like we're gonna get so long into. Age, is that nice, or am I being, is that not the way to say that? Adults needing help with activities of daily living due to age. Is that correct, or is that not correct?
I don't think you need to say age.
Okay.
There is one thing that is left out. Home care service. You got the nursing home, you got the assisted living.
Yeah, but they are home. They are not in a facility. They are home, but because their health declined or they got sick, they need help with activities of daily living. So they can apply for Medicaid long-term care services with this change.
I think I get what you're going for, George, and also what you're saying, NJ, and I'm trying to parse through that because George is right that Medicaid long-term care services will pay for a home care worker.
Yep.
But I don't know how we.
Medicare won't, Medicaid will.
Yeah.
I think this looks good.
I might take this one back to our long-term care policy team and get their thoughts on it, because I'm also not sure about these first two. I'm not sure that I love how they're written, because it's repetitive, right? Because it's the exact same words. And how do we call out that this could be age, physical, intellectual, or developmental disability without saying something that's impolite or unclear? Excuse me. So I might take this one and probably this one as well back to them and see if they have any suggestions on how we can word these. Let me mark them both as yellow.
Well, I can tell you that if home care is not in there somewhere, that's going to leave about 63% of people that are on home care.
Where are you getting 63%?
The Oregon Health and Human Service. And due to the disability population keeps growing each year, every 2 years.
Okay. All right. So I will take those two back for wording, but overall, are we liking this layout and this organization?
Yeah, I think it looks good. Considering the first thing we thought about earlier was the fact that it was fragmented. I think it's good now. It's put together.
Yeah, I think. Yeah, I'm liking the suggestion. Do we have any other feedback, comments, or concerns about the text?
Yeah, we'll get everyone a copy of all this so you can
Okay.
think about what suggestions you want to make, but it'd be great if anything jumps out to anyone right now.
I had a question. This is Dion. I'm wondering on the very bottom, the other, like it's really just like everything else, but is there, I don't know, examples of, because we don't know what we don't know. So, just anything that would maybe stand out that could be listed as, jog their memory. I don't know what would actually go in there, but
Yeah,
So-
it kind of looks weird there. It's like other what?
right.
So, I will tell you guys functionally how it works, and then you help me, okay? So functionally for medical and TANF, if they check this, they're navigated to the application summary, which is a screen that basically gives an overall look of everything you've entered on your everything that's entered on your case. So let me pull over what that looks like. It's like this big long, it's this one, big long summary of everything. Okay, like everything we know about you. I'm scrolling, it went for a long time. All right, that's what that looks like if you are receiving medical or if you're receiving SNAP. Or I'm sorry, medical or cash. For childcare and for SNAP, below this kind of like other category, so something that's not listed, if they are only receiving SNAP and or childcare and they check this, rather than being navigated to this screen, they actually get a free text box to just kind of type things in. Because the reason for that is when they're in SNAP SRS, they actually only have a very small number of questions that we collect from them. So there's a lot of stuff that somebody might come in and feel like they need to report a change on that we're not going to show them the options to report the change on. We're going to show them this instead. So
actually, I don't think the problem is the statement. Am I wrong? That something that is not listed in the reasons shown above. I think that's fine. It was the word other. It just kind of hung there like, what? Am I supposed to fill that out? What? Other. Is there another word we can use other than other?
We could just have nothing at all and just have like
a
space.
Yeah. Something that is not listed above. Yeah. And that yeah.
Okay. I like. Not physical, visual.
Well, you may not be good at Zoom it, but you're sure good at this. Your spreadsheet is just like zip, zip.
So I'll spend 30 seconds giving you a hilarious story about me and spreadsheets, and then we'll get back to this. As I mentioned, really love the Girl Scout program. My kid is a Girl Scout. I was at a service unit, which is like a regional area meeting a couple of months ago. And the manager for the service unit goes, "Hey, is anybody really good at spreadsheets?" And what I thought to myself was, oh, she has like a 2-minute question about spreadsheets. And hey, I am pretty good at spreadsheets. Long story short, I'm now the service unit treasurer.
Oh, no.
So if you're good at spreadsheets, tell them no. Lesson learned. No, I'm bad at spreadsheets. But it's just funny that you're like, oh, you're good at spreadsheets. Yeah. I know, I got myself an extra volunteer position out of it.
Now, isn't it called Scouts now? It's Girl Scouts and Boy Scouts?
Just Boy Scouts or Scouts, and it's Scout America. It's a little bit annoying because it intentionally makes it seem like Boy Scouts and Girl Scouts have merged, but Girl Scouts did not merge, and we are an independent organization. So you can still get your cookies. You don't have to move over to getting Boy Scout popcorn.
Yeah, right.
Okay. If we're all good here, I'm going to send these two off to my contacts with long-term care services policy to see if they have any thoughts on this wording. When I get that back, I will get this sent out to everybody. I do not know how many work items this is going to take. I've kind of given like a high-level warning. It's going to be a couple probably because we're going to have to rearrange and then remove some questions, add some questions. But I would like to like working on it so we can see it soon.
They're not going to complain that, oh, these work items can't be separated. We can separate these out, huh?
I have observed that they stopped being so crabby about that, and I'm okay with that. But if needed, Andrew and I actually are going to be in the office with the Deloitte team next Tuesday. I'm looking for Andrew to nod so that I know I remembered correctly. Yeah, thank God. So we can make nice and talk them into things at that time.
Cool.
There is a little bit of a rule of cool though. What I've learned over the past few years is that our partners with Deloitte, especially on the development team, do see that the ONE online portal is not especially user-friendly, and they do want to flex the rules as much as possible to see if they can get it to be more user-friendly. So if we come up with something cool, sometimes they'll get super on board and let us get away with some shenanigans. So we'll see.
Excellent.
Okay.
Samantha, I've got a question for you.
Sure.
With that picture that you had brought up earlier.
This one?
Well, it had a question mark on it, where you had a yes and no.
This one?
No, it was a.
Is it not showing? Oh, there it is.
Yes.
Okay.
With this question mark, is that question mark out of there?
That question mark is still there.
So I'm wondering, did we skip this where it listed what that question mark was about?
We removed it on, we removed the question mark on, what was it, resource?
Liquid resources.
Yeah.
Right.
Was this guy. See, it's all out here now. Well, for liquid resources, and then it still exists for some of these other ones. So we do still need to keep in mind that we have that workload we wanted to do where we wanted to create the screen that explains some of the iconography of the ONE online portal so that people can understand.
And I was just kind of thinking maybe if it isn't already done, I was kind of wondering, are we going to be doing those other question marks too, or are we just going to leave them?
It's up to you guys. We could pull them out onto the screen, or we could create a screen that explains what the question marks mean that we put up at the beginning of the application. So every time people utilize the system, they get a reminder, oh yeah, that question mark is something I can click on and it'll give information.
Well,
Well, this is really good progress. I mean, I think so. I don't know. I hope everyone else shares that. But it'll be get a draft together, give you all actually a chance to look at it and not send the email out an hour and a half before we start the meeting. And hopefully we can finalize something next month. And
Awesome. Oh,
yeah.
yay.
Thank you, Samantha. That was impressive. and you'll notice on the agenda that I had a few minutes to talk about what is going on in the feedback world. And so let's see. So okay, yeah, this boy, what does that all mean? I wanted to point out that there's a few surveys that are going to be going out. Now, there already is a survey that exists for us. This is the phone survey. So when, and I think we've talked about this before, when you call up the customer service line, you talk to someone, you're given the option, hey, do you want to also answer a survey? And so there's just 3 questions, and and that's it. And we actually have the results of those questions on a dashboard that anyone can see. And if you're interested in that, I'll dig up the link for it. But those 3 questions also are going to start showing up in other surveys where, let's see, I'm bringing my notes together. There's going to be the next few months a storefront, or as we call them, storefronts, basically the offices where, if you go into an office, hopefully you'll be given a card, there'll be a QR code on the wall, but a link to a survey. I'm hoping we have paper surveys too, but those same 3 questions will also appear along with a chance to have open-ended options as well. Then anytime you have a meeting, a client has a meeting with someone with ODHS, whether it's talking about their case or whatnot, they will then get a text notification, maybe a banner will pop up. I think I'm getting this right this time, Samantha, where they will again get those 3 questions. And the 3 I keep referring to as just the 3 questions. They're, how would you rate your overall level of satisfaction with the service you received? How would you rate the ODHS employees on their helpfulness, courtesy, and respect? And third one, how would you rate these employees' ability to answer your questions? But so that's phone survey, an office survey, and a post-appointment survey. Then finally, we're going to have showing up in the ONE system a separate set of questions asking how things are doing. And those are the questions we looked at several months ago. And they'll be coming back. And I just wanted to let you know it's coming out next month. Sam, is that's when the ONE system survey questions are going in? I should know this, but
I should know this as well, but honestly, not gonna lie, Andrew is such an MVP that I've just kind of like thrown all this work at him. So Andrew is the not the SMS push notification, the other one, the adding the hyperlink for the survey. Is that next June or July?
I'd have to look it up. It's coming soon because we just have been approving the design for all that.
I don't recall.
Let me see if I can get an answer.
Thank you.
And I'm saying all this just to let you know, because I want this group to be aware of, especially things like this that will be coming out. And appreciated all your input on these things. But if there isn't any questions while Andrew's looking that up, I think we're close to wrapping up. We have all sorts of fun stuff that Samantha is going to be doing for us, including checking with the policy team on those 2 questions. We're also for the request to change spreadsheet, and we'll be looking at that request 40 to financial aid statements, what exactly people are requiring to bring in. And we have a whole bunch of new suggestions that have come in on our requests suggestion form, so we'll have to review those so we can bring them to this group. So, am I missing anything else that we need for an action item coming up? All right.
James,
Yes.
I want to make a point. Also, when everybody's gone, I'll need to talk to you also. The point I wanted to make, before everybody disperses, there's been a number of people getting phone calls wanting to transfer over to other insurances and such and doing surveys. I would like to suggest your department and somehow give out security codes to people in their own homes. So when the call comes in for your guys' survey, that code needs to match what's been given to them. I've suggested to Care Oregon, and they're doing it, and it's been working out pretty well. There's a lot of scammers out there, and I'd sure like to hate to see people either turn down your guys' surveys or don't answer them at all.
I'll say all these surveys here are none of them involve us calling people. There'll be a text or a banner placement, or you stop in an office and you can do it then. I don't doubt there's other surveys out there, but I would be interested in learning more about Care Oregon's way they do it, because I had not heard of that before.
Like I'm with Care Oregon, and I got a code thing with my package, and then whenever there's a survey on the phone that comes, they have to match that code in order for me to do that survey. Then I know that it's coming from them.
Right. Interesting. Yeah, has anyone else heard of that? Okay, well, I'll follow up with you about that, George. Thanks.
Mm-hmm.
Any other questions or comments for the good of the order?
Thank you, Vanessa, for taking my place until I got here.
I didn't do much, so don't give me too much credit. Thanks, guys.
All right. We'll see you over email next month. Thanks.
Sorry, real quick, actually, I got the answer. It's for June. That
Yep.
the survey should be coming in push notifications.
Thank you, Andrew.
Thanks, Andrew.